Dr. Jeff talks love, Dr. Jeff talks life, answers your questions, cuts through the strife. Sex and intimacy, real and true, evidence-based, made just for you.
Hello, everyone, and welcome to Dr. Jeff Talks about Sex and Intimacy. I'm your host, Dr. Jeff Albaugh. I'm a clinical nurse specialist, certified sexuality counselor, researcher, author, and sexual health expert. This podcast is dedicated to providing evidence-based information and meaningful conversations that help you to improve your sexual health, to strengthen your relationships, and to enhance your overall well-being. Whether you're discussing intimacy, communication, medical conditions, sexual function, or the emotional aspects of relationships, our goal is just to educate and empower and inspire you. This is episode 82, Beyond the Bathroom, What Every Man Should Know About Urologic Health. Whether you're joining us live or listening later on your favorite podcast platform, thank you for taking time out of your amazingly busy, miraculous life to be with us and learn more. You're what this is all about. Thank you. We're connected across so many platforms. We're on Facebook, we're on YouTube, we're on LinkedIn. A quick favor, if you are a Facebook person, follow us. The more people that follow us, the more we can do on Facebook. We appreciate all of our followers and all of your listening and learning from us. Visit the website. You can learn more about upcoming episodes on the calendar. You can watch the 80 some odd past episodes with all the unbelievable guests that we've had on. So please go to the website. You can take us with you. Wherever you're going, we are going with you. We are streaming. We are on Spotify. We're on Amazon Music. We're on iHeartRadio. When you go on your road trips, take Dr. Jeff with you. Learn more about sex and intimacy. Enhance your relationship. When you're working out, hey, you can not just help your body, but your mind and your relationships. Take us along. As always, I would like to remind everyone that all are welcome here. Whatever your sexual orientation, gender identity, or your relationship style, this is a space and a place for you. It was designed for you, and we're so glad you're here. The mission of the podcast is simple, and I've already kind of talked about it. It's to empower and enlighten you with the information you need to make informed decisions to improve your sexual health and deepen your loving relationships so you can live that fabulous, miraculous life of yours more fully, more wholeheartedly, and with more love. So, men often put off talking about their health. We are not good about talking about health. That's just the truth. Especially when it comes to urinary symptoms, sexual concerns, or changes. We assume it's simply part of a normal aging process, right? I'm the worst. My wife's always like, are you going to go see a doctor about this? Yeah. But, right, it'll go away. It's going to be all right. Unfortunately, waiting too long can delay diagnosis and treatment for conditions that often are very manageable and can be addressed early and easily. So today's episode is all about helping men become more proactive rather than reactive when it comes to their urologic health. I am delighted to welcome Dr. Ahmer Farooq. He is a board-certified urologist we're going to have an informative discussion about the conditions that affect millions of men every year. He's going to talk about enlarged prostate, a little bit about urinary symptoms, kidney stones, different things, erectile dysfunction, men's health, low testosterone, prostate cancer stuff. Just touch on some of those things. And we'll also address some lifestyle habits, yes, that support urinary and sexual health. We're always talking about those lifestyle things, and we will be discussing that this evening as well. When it's time to, and then when should you seek medical evaluation? And what can you expect when you go visit the urologist? So my guest tonight, I am so excited to have him here. He is Dr. Ahmer Farooq is a board certified urologist dedicated to providing comprehensive patient centered care for men and women with a wide variety of urologic conditions. His clinical interests include men's health, benign prostatic hyperplasia, BPH, kidney stone disease, urinary disorders, erectile dysfunction, prostate health, and minimally invasive surgical treatments. He's known for his compassionate approach and commitment to patient education. Dr. Farooq believes that informed patients make better health care decisions. He works closely with each individual to develop personalized treatment plans that improve both quality of life and long term health outcomes. I am so excited to welcome my guest and welcome Dr. Farooq.
Hi guys, thank you so much for having me, Jeff.
Thank you. And I'm sorry if I didn't say your name exactly right. Usually I'll try to remember to ask you beforehand.
That's okay. My name is Ahmer Farooq. I'm the director of men's health at Loyola University Medical Center, and really appreciate the opportunity to talk to you all regarding our topic today: beyond the beyond the bathroom. What every man should know about urologic health.
Right. And who
So,
doesn't need this subject? So
oh,
I am so excited to have you. And without further ado, I'm going to hand it over to you and your presentation. It's all
okay,
you.
great. Thank you so much. So today we're going to beyond the bathroom to talk about something that affects every man, but that most men avoid discussing: urologic health. Whether it's getting up multiple times at night to urinate, worrying about prostate cancer, or noticing changes in the bedroom, these are incredibly common issues. And the good news is that most of them are treatable and many can be preventable. So, today's goal, I'm going to give you the knowledge and confidence to take charge of your health. We're going to touch base on enlarged prostate, urinary symptoms, prostate cancer screening, erectile dysfunction, kidney stones, and then some lifestyle habit changes. First and foremost, what is the prostate? So, prostate, also know, is will affect the majority of men as men age. They have what's called an enlarged prostate, or what we call benign prostatic hyperplasia, or BPH. You may have known that it's more commonly known as. The prostate is a walnut-sized gland that sits right below the bladder and wraps around the urethra, the tube that carries urine out of the body. As men get older, the gland grows, and when it does, it can squeeze the tube and make it more difficult to urinate. So here, if you can look on the picture here, this is a normal prostate size, smaller gland. As men age, the right picture shows you a man with BPH. So it's kind of like, I describe this to men as like, okay, your bladder is the kitchen sink and your prostate is the drain. And sometimes that drain gets clogged for various reasons. We don't really understand exactly why. However, we know that there's some lifestyle changes, some medications, some treatments that we know, and we'll get into some of that that can help improve. Now, how common is this? Well, BPH affects 50% of men between the ages of 51 and 60. And by the time you're 80, 90% of men over the age of 80. So this really means that this is going to affect you in some shape or form. So you're not alone, and this is something that every man will deal with. So you need to know about it ahead of time. So some signs and symptoms of BPH or enlarged prostate: frequent urination, getting up at night to urinate, urgency to urinate. That's when, like, you got to go, you can't hold it. Difficulty to begin urination, straining to urinate, pushing to urinate, weak flow where it's coming out and it's taking forever, dribbling after urination. These are all some of the common symptoms of an enlarged prostate. Risk factors that can cause you to have a further enlarged prostate. Well, definitely family history. So it's good to talk about this with your brothers, your cousins, your dad. Hey, dad, do you have any issues with urination? Have you been treated? I can't tell you how many patients I meet and see, and they're like, they have no idea what their dad did, but their dad had some prostate surgery for for some reason, but they don't talk about it. And so we're here to say, hey, this should be an open discussion because it can be hereditary. You can pass it on to your sons. So positive family history, obesity, being overweight does increase your risk for having BPH symptoms. However, having high physical activity, going to the gym, working out, has actually a protective effect, meaning like you will actually have less effects of enlarged prostate. And of course, heart disease, if you have that, you are also at a higher risk for getting enlarged prostate symptoms. So some treatment options, typically we try with behavioral modifications first, adjusting fluid intake, especially at night. I tell patients, okay, 2 hours before bedtime, cut off your fluid intake so that you're not getting up at urinating. Watchful waiting is where we are, okay, you're very in tune with your body. You notice, okay, now I've been peeing more than usual. I haven't changed my diet. What's going on? Well, probably you're having some mild urinary symptoms from BPH. So something to keep in mind until it gets bothersome. You can do some bladder control exercises that can help you relax the pelvic floor and help you urinate better. But sometimes that's not enough. The lifestyle and behavioral modifications are not working. Then we go to the first line therapies, which includes BPH medications. That would be something like an alpha blocker. You guys may have heard about something like Flomax or alfuzosin. Those are medications that help relax the prostate. Where if you remember my picture, that area that's kind of clogging the drain, it kind of helps relax that area, causes a passageway so that urine can pass more easily. There's medications that can also help shrink the prostate. Then, of course, there's minimally invasive procedures such as Resume, where we inject steam into the prostate to help melt that enlarged portion away. We can scrape it open surgically. We can laser it open. So getting into the surgical techniques, sometimes if you're failing medications or if you just don't like taking medications, there is a procedure that we can fit you in. There's also stents coming out, recently been FDA approved for people that don't want to take medications or have side effects from medications. And it kind of buys you time, as you know that this is a disease that grows with you as you age. And so we can give you a break from medications and the symptoms by putting a procedure or doing a procedure that'll give you maybe a 3 to 5 to 10 year break from relying on medications. And then there's ones that are more permanent, that are more invasive, such as like a robotic surgical removal of the prostate and whatnot. And so treatments do get tailored to your size of your prostate and the shape of your prostate. Switching gears, prostate cancer, big picture view here. Okay, prostate cancer is the most common cancer in men. About 1 in 8 men will be diagnosed during their lifetime. But when caught early after treatment, 5-year overall survival is above 98%. I mean, this is amazing. And actually, we now have 10-year data, 15-year data showing that this is a disease that we live surpassed all the time now. But early detection is key and it saves lives. How do we do this? When to start? Well, average risk patients, meaning like, hey, I don't have any high risk features for prostate cancer, which would be a family history of prostate cancer. Again, talking to your dad, your brothers, your cousins, your uncles, making sure has anybody had prostate cancer, even asking for your mom if they've been positive for the BRCA gene. It's more recently been found out that if you have anybody in the family that's had breast cancer or even pancreatic cancer, you might be at risk for developing prostate cancer because that's a gene that kind of is shared amongst those cancers. Or if you're a Black man in this country, for some reason, we do have a higher risk for prostate cancer. If you've been exposed to Agent Orange, if you served in Vietnam, that's also a higher risk for prostate cancer. And so you are going to get screened earlier at the age 40. Average risk, we're talking 45. It's a simple blood test. It's called a prostate-specific antigen. And you kind of work with your doctor and say, hey, I'd like to get screened for this. And if you're a candidate, they will order that for you. And then if it's normal range is usually, and it depends on the age. So somebody in their 40s, their PSA should be typically under 2, around 2.5 or less. And it will go up by a little bit every year. We expect as the prostate enlarges, this PSA will also go up. But what we worry about is if the PSA goes up too quickly. And that's when we want to check it more frequently and then possibly further work it up. However, if it's in the normal range, we'll check it every year, every couple of years, depending on your risk factors. So what if my PSA is high? Well, if the PSA is high, that does not automatically mean you have prostate cancer. You really need to have a prostate biopsy to confirm whether or not you have prostate cancer. Other causes could be, as I mentioned, enlarging prostate could be, infections in the urinary tract, or recent vigorous exercise. I've had some patients, they are doing marathons and they happen to, bike the 12 miles for a marathon, or I'm probably not saying that appropriately. I don't know how many miles they actually do it, but that can actually increase your PSA level when you're sitting on that small bike leaning forward. It can actually release that protein into the blood and cause a spike. So we kind of have a reason for it. Sex can also increase, ejaculation can also increase that PSA. However, I never ever make a decision for a biopsy based on one blood test. I usually will repeat it. And if it's still elevated, standard of care is to get an MRI of the prostate, get more specific pictures, make sure that there's no suspicious areas. And if we do see any, then we would proceed with a biopsy. However, don't avoid the conversation out of fear. Knowledge is key. This is something that really saves lives, and that this simple blood test, it's not perfect. However, it's still what's most commonly used to screen for prostate cancer. Switching gears, erectile dysfunction, much more common than you think. It affects about 50% of men aged 40 to 70 years of age to some degree. Over 20 million men in the United States have this condition, and over 300 million men currently worldwide. But the issue is many men wait for years to see a provider like myself regarding this. But I'm here to tell you, erectile dysfunction is a medical condition. It's not a personal failure. It's not something that as you age, you just have to settle with. You really need to be in tune with the fact that having this could be a first sign of actually your health, your overall health. And so there's multiple causes for erectile dysfunction. There's inflammation in the body. Of course, there's mechanical issues such as anatomy issues, psychological issues, and then the blood vessels being blocked, trauma, hormonal issues, neurologic disorders, medications that can cause it. There's a lot of different factors. However, erectile dysfunction is really one of the first signs of a man's overall health. And so you really have to be in tune with that. We call it ED as a window into your heart health too. The blood vessels in the penis are much smaller than those in the heart, and they show damage much prior to any kind of heart disease. So men with erectile dysfunction actually have a 43% higher risk of getting cardiovascular disease and a 59% higher risk of having coronary artery disease, which is the vessels in your heart. And erectile dysfunction can actually predict a heart attack by 3 to 5 years. So a lot of men, I will interview them after they've had a heart attack, they've had a stent placed, and I was like, were you having any sexual dysfunction prior to? A lot of them will say, well, yeah, I did start to have some weaker erections and stuff more consistently. I didn't seek any help. And especially for men who are in their younger age, in their 40s and 50s, who really haven't had any other medical issues up until, listen to your body and go get checked out. So if you have ED, definitely get your heart checked out, especially if you're in your 40s or 50s. Treatment options, of course, improving overall health is huge. Lifestyle modifications, it's basically like a wake-up call. And I try to instill men that you gotta change this. And we do have a window of time where these onset of symptoms happen, where you can actually reverse the symptoms. And because if you let it go for too long, then you're going to be dependent on medications, you're going to be dependent on other treatments, and you may have other medical conditions that you haven't treated for several years that you'll need permanent treatment for as well. So it's really important that you get yourself screened for other medical issues. such as high blood pressure, diabetes, and to make sure that you're overall healthy to help improve this. Other treatment options were oral medications, also known as a class of drug PDE5 inhibitor. So that's your Cialis, Viagra, Levitra, and they all first line, so they work pretty well. And if you can't take those for some reason, there are patients that have other medical conditions that keep you from taking those. Then you can use a vacuum constriction device. You can use injections where there's a medication that you actually inject to the side of the penis. It works really well, especially for men that have had treatments for prostate cancer. There is a suppository you can put in the tip of the penis. It's kind of harder to find now. You need a compounding pharmacy to do that. There is an over-the-counter medication you can get now at Walgreens and I believe Amazon called Eroxon. It's a gel that you put on. It burns a lot, to be honest with you, but it can help in a very, very mild erectile dysfunction patient. And then penile prosthesis, which is a surgical procedure where we place a device into you, which has the highest satisfaction rates if you fail any of the above. As far as lifestyle modifications, well, there's several studies that show that you can really reverse some of your erectile dysfunction. And 1 in 3 obese men with erectile dysfunction regain normal function by controlling their diet and exercise. Quitting smoking improves erectile function. Switching to a Mediterranean diet, maybe a ketogenic diet as well. Now there's more studies coming out linked to a healthier heart, which in turn links to improved sexual health. And then vigorous exercising 3 times per week for a total of about 120, 150 minutes also helps improve erectile function. So these are things that, really men come to us as urologists as like, hey, out of all the other medical problems I may have, I have this issue that I'm really upset about and I want to get better. Well, I'm looking at their laundry list of other medical issues and I'm like, hey, unless you get all these things fixed, this erectile dysfunction is not going to get fixed. So a lot of times it's as a physician, it's nice that I'm able to empower men to help them better understand their medical conditions and knowing and telling them how important it is that they address those to help their erectile function as well. Kidney stones is something that we see commonly in urology. About 13% of men will develop a kidney stone in their lifetime. Without prevention, it's up to 50% recurrence within 5 years. So it's really important that you do strategies to prevent it. And what's the number one strategy is, gentlemen, drinking water. And you want to drink about 100 ounces of water every day to prevent stones. And that's about enough to make about 2.5 liters of urine every day. So I tell men, hey, look, if you're going to the bathroom, if your pee is not clear, then you really need to up your water intake. And fortunately or unfortunately, a lot of men think about me while they're peeing, but purposely so. I want them to know that they got to really be, peeing and that urine has to be clear. It's one of the ways where you can measure if you're drinking enough fluids. And this really, really reduces the recurrence rates of kidney stones in half. So dietary tips, diet also plays a role in kidney stones. So eating a normal diet with high calcium is totally fine. Our bodies do need calcium. Our bones need calcium. So eating too much calcium is actually not a thing. It actually can be protective against kidney stones. But eating too much salt, eating processed meats, eating fast foods, these can lead to kidney stones. Sugary drinks, sodas, colas, eat more fruits and vegetables. And again, sip the water throughout the day. Don't be chugging 2 liters at once. Otherwise, you'll be going to the bathroom a lot, and that won't be really a prostate issue. It'll just be a water intake issue that you've been binging. And some people do have to binge because they can't drink at work and stuff like that. But just be cognizant, or just be aware of what you're doing to your body. All right, low testosterone, another favorite topic of mine. So what to know? So symptoms of low testosterone: fatigue, low sex drive, depressed mood, loss of muscle mass. These are some of the symptoms many have. And these symptoms actually can have many causes, I should say. But low testosterone is just one possibility. So how we diagnose this: 2 early morning blood tests plus symptoms. You have to have symptoms. Treatment can be very effective if it's truly indicated. So if we just go out into the population and start checking testosterone, it's probably going to lead to a lot of overtreatment. At that point, it's just the number. You have to have symptoms with a low testosterone to really reap the benefits of needing testosterone. Okay, so the big five here: lifestyle habits that protect your urologic health. Stay active, up to 150 minutes per week of moderate exercise. Brisk walking counts. Start if you're not doing much at all, start with walking. It's totally great. It gets your body moving. I tell every patient, after a meal, get up and go for a 15-minute walk. It really helps with your erectile dysfunction. It really helps with your urologic health. Eat well. Know what you're putting in your body. Try to put in whole foods. Mediterranean style diet or ketogenic diet really helps. Maintaining a healthy weight. We know obesity worsens enlarged prostate. It puts you at higher risk for kidney stones. It puts you at higher risk for prostate cancer. So how do we do this? Well, there is a diet and a book that I recommend to people. It's called The Obesity Code. It's by Dr. Jason Fung. He's a kidney specialist, but he looked at all the data and looked at, okay, like, what do I do? Why are men getting so obese? Why are women getting so obese? And especially on the Western diet. And he kind of breaks it down very nicely. And he also has a nutritional institute now. And so I've had several men lose 10, 20, 60, 80 pounds doing intermittent fasting, having a protein-centric diet if possible, and eating less carbohydrates, which really, if you start your meals with carbohydrates, it turns right into sugar. So you don't want to do that. And if you start your meals with a salad or some protein, your body gets busy breaking that down. It won't notice any carbs that you might be taking. So obviously stop smoking and staying well hydrated also helps. All right, so action plans. If I can give you any advice, schedule your annual checkup. Guys don't regularly go to the doctor after their high school physicals if they played sports. You really don't go unless you really, really have a problem or you have a significant other that really pushes you to go to the doctor. So you got to be comfortable. You got to be proactive. And I see a lot of men on social media, and even though on the internet there's not, some of the information's not great, but I'm glad that there's a lot of information out there because I want the questions. I want you to come in, do your research on ChatGPT and whatnot, and whether it's right or wrong, we talk it out. I'm just proud that you're taking your health under control. So you have to have that motivation to do it. Talk to your doctor about prostate screening. Don't ignore your urinary symptoms, and don't be embarrassed about your sexual dysfunction. It's a medical condition, okay? And it could be the first sign of heart disease. It's really important. And start by doing one major change thing a week and take it a step at a time. You don't have to do a lot of changes at the same time. So your body is giving you signals. The key is to listen. The key is to act. Thomas Edison had this great quote that I think, he was alive from 1847 to 1931. The doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause of prevention of disease. Now, he had that foresight. We're going back and we're lowering now that, okay, look, there's a lot of preventive stuff that we'd like to do. And sometimes your doctors don't know all the answers to how to prevent things, because we do practice reactive medicine. If you have this, then I can prescribe this or do this surgery. But it's okay to challenge your doctors in a meaningful way so that you can still make the lifestyle, dietary changes, weight loss, improvement in exercising to really make an impact on yourself. So thank you so much. I've probably talked too fast. I apologize if I did. I'm happy to answer any questions at this point. Jeff and Vic.
No, you did not talk too fast. You did great. It was exactly what we were looking for, and I think you covered a lot of ground in a little amount of time. So, I think that what I think is interesting is with the whole BPH thing, it seems like we kind of tell men, if you live long enough, this is going to be a problem, right?
Correct.
It's
Yeah.
something that you need to realize it's a reality in our lives. If you live long enough, you're going to struggle with enlarged prostate symptoms, and those symptoms can be things that have to do with retention and not emptying completely, or a slower stream, or they can have to do with also with you know frequency, urgency, all those different irritative type symptoms. But yeah, it just seems like it's sort of, if you live into your 70s, 80s, 90s, it's going to happen.
Yeah. Yeah. And I think, just knowing that, one of the key signs, I think, that we need to study this better, Jeff, is the speed that you urinate in. I think that matters, and that's one of the first signs that things are slowing down. Even though our symptom scores catch bother symptoms more, right? It has that built-in kind of um, catch that we're trying to say, okay, like it doesn't really matter as much if you're slowing down as much as you're not bothered by it. But I think it is one of the subtle signs that you might be, suffering from enlarged prostate. And when I say enlarged, guys, you have to understand that sometimes the overall size could still be small, but the shape is enlarged, like it's like kind of kind of growing inside the bladder, kind of in a way where it could be blocking the flow. So it's not just overall size of the prostate, but we
Right.
say enlarged prostate just because it's easier to kind of understand.
I think you bring up a really good point, because we always say that some of the men with the worst obstruction don't necessarily have a really big prostate, right? So when your doctor's doing your prostate exam, you're like, but he said it was fairly normal and not majorly enlarged. That doesn't mean it's not pinching in on the urethra and causing all those both irritative and retention type symptoms from the bladder. So that's the thing that sometimes I think listeners, we forget, is it doesn't matter if it's growing big out. It matters how much it's squeezing in on the urethra, which goes right through the middle of it, right?
Absolutely. Well
Yeah,
put.
kind of a big deal. So yes, so our questions, basically we have that people in the biohacker community, let's see, have been saying all men should be on low doses of Cialis. As an academic physician, do you believe there's merit or support for that? I think because we know tadalafil or Cialis can be used for BPH in addition to erectile dysfunction. So what do you think about that question?
I think I think putting all men on this is probably an overstatement. This is a subject that we need to study. I do believe taking a daily low dose Cialis is probably healthy if you have symptoms, and I think taking it more often than not will help you, because the Viagra came up as a heart pill, right? It was actually being invented as a heart pill, and we
Absolutely.
noticed the side effect of like, whoa, wait a minute, these guys are getting erections, and so then it turned into so it is a cardioprotective pill, but I would hesitate from going to that length,
Hmm.
like Huberman does. And I watch his shows, and I understand what he's saying and doing, and there's nothing wrong with having that opinion. However, I don't think I can make that argument. I'd like to see some data that supports that. Theoretically it's there, sure, but I like to support, I don't like taking it like I would like a supplemental vitamin, or like I'm a big fan of vitamin D3 and, like, B complexes and stuff like that. I advocate for, I don't think I could do that for that. However, I will say, for patients that have erectile dysfunction, I think there is better results when you take a low dose Cialis, and then you complement that with a dose of Cialis for sexual activity.
Hmm. Right. Yeah, and I think too, you bring up a really good point, and I know we have a lot of patients, and I'm sure you do too, who have BPH and erectile dysfunction. So those daily, which is always 2.5 to 5 milligram doses of that to help with urine flow, BPH issues, and to help with erectile function in general can be helpful. Sometimes they need a little bit of a booster dose. And again, all this is done under prescriptive authority with whoever you're working with. So work with your prescriber on how you should take it, but you don't want to exceed the 20 milligrams in any 24-hour period as the prescribing information says. But yes, I think that's true. Like you said, I don't know that I would advocate it for just anybody, but gosh, those men who have those BPH symptoms and erectile dysfunction and could benefit from that two different issues being helped.
Absolutely.
I think those are great candidates for tadalafil. And these drugs, these PD5 inhibitors, sildenafil, Viagra, tadalafil, Cialis, vardenafil, these different drugs, they were designed to be pro cardiac drugs and hopefully kind of be slight antihypertensives, but they didn't work all that well for that. But as you said in the studies, the men didn't want to give back the pills at the end of the study because they were helping with their erections and they were reporting this really positive effect.
Right.
So, but no drug is the be all end all. Some people get, a fair amount of people get headaches, nasal stuffiness, facial flushing. Nothing's perfect. So you have to figure out with your particular provider, is it the right thing for you?
Sure.
And our advice and our thoughts are not your own providers of thoughts. And you, nobody advocates for you, listener, better than you. So you're a team with your prescriber and your provider. And that's how you figure out what's best for you, for sure. So I have a question that came up here. I've heard conflicting information about PSA testing. We know that that has been a source of debate over time. And prostate cancer screening. Who should be screened? When should screening begin? How do you help patients make that decision? And we both know that's a very individualized decision, but what do you say about that?
Yeah, I think so. Men who are at higher risk for prostate cancer, they have to be screened in their 40s. And so the key things to ask there from my perspective, okay, when was your family member diagnosed with prostate cancer? At what age? What age were they treated? And so based on that, we used to say, okay, 10 years earlier. But I think now the more data shows that we should just check you when you're turned 40. Check one PSA. If it's below one, you can probably not check it for a couple of years or start checking it annually. But high risk factors, like I mentioned, of family history, being a Black man, having exposure to hazardous materials is key. Now, the general population, 45 years old to 50 years old latest, you should get a PSA. So in Europe, I think their guidelines are if your PSA is checked once, you have low risk factors, it's less than one, you probably don't need to check it for up to even 5 years. I think in the US, it's more personalized. Patients have more say. And so typically I'll say, okay, every year, every couple of years, let's check it to make sure we're on the right path.
Definitely. I think it can be tricky and it should be individualized. A second question came in. Since my husband's prostate surgery, our intimacy has changed and we're both struggling to talk about it. What advice do you have for couples who are trying to adjust to changes in sexual function while maintaining a close and loving relationship?
What a great question. I love it when spouses, come up with questions, come to appointments, because you're really trying to understand. You see, sexual function is a two-part system, right? Like, so you got to know the partner, you got to know, what's going on with them as well. So I think we have to know, what you're trying to achieve, what the limitations are. So for a man, for example, if they're not achieving the erections, then we need to jumpstart that. And for women, we need to see how's your libido, how's your sexual activity. There's a lot of shyness too, that conversations aren't happening between couples because one feels like, oh, I'm pressuring my partner too much, even though I can be sexually active or maybe I'm a little healthier, but I don't want to put that pressure on my spouse. Well, there are treatments that we can do for couples as well. So, and so I do at Loyola, we run a sexual wellness clinic. I was telling Jeff, where we treat couples. And so I have a gynecology part, we have a psychiatry part, we have to learn everything. And I know Jeff does a lot of this work as well.
Yeah, definitely, definitely. So, and I do think, and we always encourage people, if you have a partner or partners, bring them with you. They can participate in the appointment as well. And I think that can really, really be helpful. Gosh, a lot of great information to unpack, a lot of good things we've taught. I'm going to come back and ask you for just a final sentence that you would say to listeners in regards to men's sexual health in just a minute. But first, I want to do a little bit of a centering exercise. When we come to this part of our program, we're kind of bringing back people into their bodies. So before we end today's episode, I'd like to invite you, listener, to take a quiet moment for yourself. If you're comfortable doing so, place both feet on the floor and sit comfortably. Wherever you are, get comfortable. Take a slow, deep breath in your nose and gently exhale through your mouth. And again, breathe in confidence and breathe out hesitation. One more time. Inhale the intention to care for yourself. Inhale self-care. And exhale the belief that you have to face health concerns alone. You do not. Keep breathing in your nose and out your mouth. Silently repeat these words as you breathe. My health matters. My body deserves my attention and my care. My body deserves my attention and my care. Seeking help is a sign of strength, not weakness. Seeking help is a sign of strength and not weakness. Every small step I take today is an investment in my future. Every small step I take today is an investment in my future. I choose knowledge over fear, action over avoidance, and hope over uncertainty. I choose knowledge over fear, action over avoidance, and hope over uncertainty. Take one more final breath, and as you exhale, consider one thing that you could do this week to support your health. Maybe it's scheduling a checkup, asking a question you've been avoiding, exercising, drinking more water, improving your sleep, or simply starting a conversation with someone you trust. Remember, as you move forward, taking care of your urologic health is taking care of your whole health. Small actions today can lead to healthier tomorrows. So, Vic, can you tell us what's up next week on Dr. Jeff Talks About Sex and Intimacy?
Anxiety doesn't stay neatly contained in our minds. It often follows us into our closest relationships, affecting emotional closeness, sexual desire, arousal, communication, and confidence. Whether anxiety is related to work, family responsibilities, health concerns, past experiences, body image, or sexual performance, it can create a cycle that leaves individuals feeling insecure and partners feeling disconnected and misunderstood. In this episode, Dr. Jeff welcomes Melissa Novak, a certified sex therapist and anxiety expert, for an insightful presentation and discussion about the complex relationship between anxiety, intimacy, and sexual well-being. Join us on August 4th at 7 p.m. Central Time to learn more.
Yeah, that's going to be a great conversation. Melissa's wonderful. I've worked with her on other projects before. She's a great sex therapist. I'm looking forward to that. But this week, gosh, Dr. Farooq, thank you so much for being here and being a part of our episode and sharing your expertise on men's urologic health. Final parting words to listeners. What do you got for them?
Well, I think, to every man listening, you got to take your health seriously. Don't wait for a crisis. Don't be bashful. Don't be embarrassed. Schedule that checkup. Have the conversations about screening. mention the symptoms you've been ignoring, and start making the lifestyle changes today that will pay the dividends for the next decades. You really can make a difference. And those healthy habits, they're really, you can start small, but I've seen the changes. I've seen the patients seeing me less, and they're sending me emails still yearly saying, hey, you know what? You empowered me to do this. So use me. We're here to help you. Use Jeff as he's been doing. I mean, Jeff, you're doing a phenomenal job educating men, empowering men. And I think the message is, don't wait. Take your health seriously, guys.
Totally. Listeners, no one will advocate for you like you. That's for sure. And you're a team. You're co-creating your health with your providers. So do that for sure. Thank you for spending time with us on Dr. Jeff Talks About Sex and Intimacy. Until the next time, I want you to take care of yourself. Take care of those you love. What greater investments than in you and those you love? And remember that healthy relationships, including that one you have with your own body, with yourself, begin with knowledge, compassion, and the courage to seek the help you need. Thanks for joining us. Goodbye.
Dr. Jeff talks about sex and intimacy, breaking down the science, setting your spirit free with stories, wisdom, laughter, and care, connection and confidence. He'll take